At the beginning things were slow and finding new patients was hard, and being very new to the whole marketing environment, I realised that actually I had to accelerate my private practice growth. And traditional methods were generally composed of sort of waiting, seeing whether you were getting known, maybe talking to GPs through talks and networking slowly. But looking at the way we practice and find new patients today, I've realised that accelerating that with a marketing company like yourselves was certainly interesting and certainly proven. So I looked at your guys and looked at your record with past sort of promotions of other eye clinics, such as the refractive industry, and realised actually some of those principles could be applied to my work in general ophthalmology and cataract and retinal conditions. I think really getting on board with doing something out of our comfort zone, something that was a little bit different to what traditional doctors kind of rely on. They rely on sort of knowing their practice and doing medicine, but actually getting into that sort of marketing, promotional side of things is quite difficult. And actually putting yourself out there, not being scared of actually saying, look, I'm here, I'm present, I'm available, and I'm keen. And using sort of the internet, using websites, that's self-promotion. That's a kind of a hard step for some doctors to take. Getting on board, promoting myself through social media, that was quite exciting. Developing content, trying to work out what patients wanted, because I wanted to be very patient-focused. I wanted to understand that what patients needed, whether we could provide that, and on the back of that, say, look, I'm here, ready to practice and grow. And a real challenge to sort of grow my private practice month on month, but with measurable objectives. I had some knowledge of marketing beforehand, but I wasn't quite getting to the levels that I wanted to. And I think when you see results and when you start to see things grow, you start to believe that those techniques tend to work. But you do have to have some sort of understanding that things sometimes don't work, and that knowing when they don't work is just as important as knowing when things do work, and then promoting the things that do. I think that was the key.